Do you sometimes have sudden attacks of anxiety and overwhelming fear that last for several minutes? आपकी धड़कनें तेज होने लगती है, आपको पसीना आता है या आपको ऐसा लगता है कि आपको सांस लेने में तकलीफ हो रही है and you cannot think clearly. If so, you experienced a panic attack. Panic attacks हमारे बॉडी का फ्लाइट या फाइट रिस्पॉन्स होता है किसी भी पोटेंशियली रिस्की सिचुएशन के लिए. Now, while obvious dangers में ये होना काफ़ी आम बात है, ये हमेशा एक लॉजिकल रिएक्शन नहीं होता. ये अक्सर anticipatory होता है of an imagined danger in the future. Many people have just 1 or 2 panic attacks in their lifetime and the problem goes away, perhaps when a stressful situation ends. But if you have recurrent, unexpected panic attacks and spend long periods in constant fear of another attack, you may have a condition called panic disorder. Although panic attacks themselves aren't life-threatening, they can be frightening and significantly affect your quality of life. People with panic disorder may have sudden and repeated panic attacks of overwhelming fear and anxiety, a feeling of being out of control, or a fear of death or impending doom during a panic attack, an intense worry about when the next panic attack will happen, a fear or avoidance of places where panic attacks have occurred in the past, a traumatic event such as sexual assault or a serious accident. तो क्यों होता है panic disorder? Genetics. Sometimes it runs in families, but it's not necessary that everyone in the family experiences it. Major stress. There could be some change going on in your life or stressful situation that you have not adjusted to or understood how to deal with. Temperament that is more sensitive to stress or prone to negative emotions. If you're around people that have a tendency to neglect or disrespect your feelings or emotions, panic attacks occur. Certain changes in the way parts of your brain function. History of childhood physical or sexual abuse. Panic attacks के लिए specific तरीके होते हैं to get in control, like focusing on your breathing, counting numbers, trying to focus on something close by, and thinking about its size, color, and texture. But panic disorders need more sustained regular intervention. Psychotherapy. Cognitive behavioral therapy is commonly used to treat panic disorder. CBT teaches you different ways of thinking, behaving, and reacting to the feelings that happen during or before an attack. The attacks can become less frequent once you learn to react differently to the physical sensations of anxiety and fear during a panic attack. Exposure therapy is a common CBT method that focuses on confronting the fears and beliefs associated with panic disorder to help you engage in activities you have been avoiding. Exposure therapy is sometimes used along with relaxation techniques. Medication. Healthcare providers may prescribe medication to treat panic disorder. Different types of medication can be effective. Antidepressants such as selective serotonin reuptake inhibitors or SSRIs and SNRIs. Beta blockers, anti-anxiety medications, but of course, these should be taken only after consulting a doctor. दोनों ही तरीके के असर में टाइम लगता है. इसका कोई एक्सेलरेटर नहीं होता है. कभी कभी ये काफ़ी फ्रस्ट्रेटिंग भी लगता है. So it's very important to be very kind towards yourself when you feel like you're failing. How can you support yourself or others who are dealing with panic disorder? Educate yourself. A good way to help yourself or a loved one who may be struggling with panic attacks or panic disorder is to seek information. Research warning signs, learn about treatment options, and keep up to date with current research. Communicate. If you're experiencing panic disorder symptoms, have an honest conversation about how you're feeling with someone you trust. If you think that a friend or family member may be struggling with panic disorder, set aside a time to talk with them, to express your concern and reassure them of your support. Know when to seek help. If your anxiety or the anxiety of a loved one starts to cause problems in everyday life, such as at school, at work, or with friends and family, it's time to seek professional help. Talk to a healthcare provider about your mental health. Unfortunately, अगर आप mental health issues से जूझ रहे हैं, तो panic attacks का complete elimination possible नहीं होता है. ये होते रहेंगे, but हाँ, इनकी intensity या frequency कम हो जाता है. Mental health issues में progress linear नहीं, ऊपर खबर होता है. तो जब लगे it's getting bad, maybe take a pause or break. This is the time you'll need both support of your loved ones and also for you to be kind and loving to yourselves. But a good thing is, it does pass. And as someone who's had panic attacks and one very recently, this is something that I can reassure you about. Mind over matter का अगर ये एपिसोड आपको अच्छा लगा तो प्लीज़ इस वीडियो को लाइक और शेयर करें और हमारी यूट्यूब चैनल को सब्सक्राइब करें. हमें हमारे सोशल मीडिया हैंडल्स पे फॉलो करें.